Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
Unfortunately, detecting glaucoma by the patient is not that easy. Just one shocking statistics to all of you. Out of 100 people who have glaucoma, when we go out and start to test them, when we see 100 people with glaucoma, 90 of these people wouldn't be even aware that they have glaucoma. So what it means is, it's not easy for a patient to know that they have glaucoma. It's like we call it as a silent thief of sight. The reason we call it a silent thief of sight is because it can steal your eyesight. It can make you, near to blind. You won't even know that it has caused you partial blindness. So people come to know they have glaucoma, or they start to suspect they have a problem with their eyesight when about 90% of their eyesight is already lost. So when they approach the doctor, even complaining of a problem, by then they would have lost most of their eyesight, and then we have to fight to retain only this 10-20% of their eyesight. So the message I want to give is, do not depend on symptoms for you to detect glaucoma, because unlike so many other conditions on the body, say for example, when you get a heart attack, you get a chest pain and then you rush to the doctor. Similarly, you have appendicitis, you have sites in your flanks and then you rush to the doctor. Unfortunately, glaucoma, being a silent thief of your eyesight, doesn't give you any symptoms in the beginning. Therefore, it may not be a reliable thing to depend upon symptoms to understand whether you have glaucoma or not. Having said that, a very few types of glaucoma, especially we call them as angle closure glaucomas, they can be more dramatic. But again, remember, they are the less common variety. In this angle closure glaucoma, a patient may have severe eye pain, redness, and blurring of vision, and usually rushes to the doctor by himself. But I'm stressing upon the point I already told. These happen to be a very small subset of glaucomas. The vast majority of glaucomas are asymptomatic, that is without symptoms. So in order to do an early detection of glaucoma, you should not depend upon your feel of whether you're seeing well or not seeing well. You should be proactive. You should go to the doctor and have an annual checkup. The checkups that we normally recommend is for glaucoma, after 40 years of age, when it is most common, we recommend that they should have an annual checkup whether they suspect they have a problem or not.
What are the risk factors for glaucoma and can it be prevented or slowed down with the lifestyle changes or medication?
The most common risk factor for glaucoma is having a genetic change which predisposes you to glaucoma. Apart from these, the risk factors are a person above 40 to 50 years of age is more prone to glaucoma than a younger person. A person who has had trauma before to the eye is more prone to glaucoma. A person who is on some of the alternative medicines as well as allopathic medications which can trigger glaucoma, which we know which are those drugs, we know the list of those drugs. Those kind of people are again prone for developing glaucoma. And a very small risk factor is also having hypertension or high blood pressure, which can again make you prone to glaucoma. But as I said in the beginning, the major risk factor is a genetic predisposition to develop it. Now, what can be done to slow down? There is unfortunately no lifestyle modification that you can do to slow it down. Unlike, say, for example, if I have to take the example of diabetes, if you cut down your sugar intake and carbohydrate intake, and increase your exercises, you can bring a good control of diabetes. However, there is no such thing that you can do in glaucoma, because glaucoma happens to be a condition which affects the inner part of the eye and has got to do with circulation of some fluid within the eye, which gets hampered and raises the eye pressure. Here we have very limited role in terms of lifestyle modifications. We do have, fortunately, very good medications to take care of glaucoma. We do have laser procedures. We do have some fantastic surgeries, old ones and new ones, which have made management of glaucoma so much more easier for us in this generation.
Agreed, doctor, what you said. How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
If there is a family history of glaucoma, I would strongly recommend that you should have a checkup once at around 20 years of age, and then every 2 years henceforth till you reach the age of 40. Once you cross the age of 40, the 2-yearly checkup should get converted to a yearly checkup, and a yearly checkup is mandatory after 40.
So doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative, and we believe your participation will greatly benefit the patients.